So when patients are referred to us for wisdom teeth extraction, it can be for both upper or lower wisdom teeth, depending why they need to come out and what sort of problem patients been having with them. We tend to take an X-ray or a radiograph to assess the possible difficulty removing the wisdom teeth. Once we've done that, I tend to have a discussion with the patient to explain what I see. There are sometimes the wisdom teeth can be quite closely related to the nerve that supplies sensation for your lower lip and chin. This is mainly the issue with the lower wisdom tooth, and impacted upper wisdom tooth can be quite close to the sinus floor. If these are the cases, I usually explain to the patient that we would benefit from taking a cone beam CT scan, and we are so lucky that we have everything under one roof. So this can be arranged, and prior discussion with the estimate of the cost will be given to the patient as well, and the reason why I'm requesting a cone beam CT scan. Once the scan is completed and I have seen it, I tend to bring the patient in for another chat to make sure that they understand what are the risks involved removing the wisdom teeth, what are the benefits of removing them, and what can be the issue if we leave them as they are. At that point, again, patient will have plenty of option to discuss if they have any queries about the treatment, the method that they want the treatment to be done, whether under local anesthetics or intravenous sedation, if they're quite anxious about getting the wisdom teeth taken out. So once the treatment plan's been finalized, again, patient will be advised of the cost for the final treatment. On the day of the treatment, there's no rush. We have music that usually helps the patient. I encourage them to bring their own headphone if they want to. I do work in their mouth where it's quite close to their ears. So if they want to listen to something, take their mind away. Once it's nice and numb, it's absolutely fine. Once patient's a bit relaxed, nice and numb, we carry out the treatment. Patient will then be discharged on that day with appropriate letters to the dentist, whoever referred them, or the patient themselves. And the patients will be followed up with a phone call the next day to make sure that they're okay. And at any point, should they need to see me again, appointments will be arranged very promptly. Wisdom teeth can cause a lot of issues, as I'm sure a lot of you have come across at some point in your life. It does not necessarily come in an angle that is easy to clean. Hence, it causes foot impaction, it can cause decay on the wisdom tooth itself because you cannot clean it, or the tooth in front of it. Sometimes teeth that's not came through can also have some diseases associated with them. Pain is one of the main reasons why we tend to remove wisdom teeth, and pain usually comes with swelling and infection. Most of the time, by the time I see the patient, they might have had quite a few infections, requiring antibiotics, a few days off work. For some patients who needs to get the job done as soon as possible, I think that's where we are quite good at organizing the next available appointment, and we are very good at keeping in touch with the patient to say yes, if we can stay back. Staffs are more than happy to accommodate patients as we need to. At the end of the day, we are here for the patients.